Okay. Hello, Mr. Flaney. My name is Mark. I'm a student physical therapist today. Have you ever been to physical therapy before?
No, sir, I haven't.
Okay, so today we're going to be doing a two-part thing. I'm going to be asking you a few questions to get to know about the pain that you're experiencing, as well as some of a physical exam. The first part should take around 15 minutes, and the other part should take around 30 to 45 minutes. Do you have any questions before we begin?
No, sir.
Okay, so Mr. Flooney, how old are you?
I'm 56.
Okay, 56.
Yes, sir.
And Mr. Flooney, what do you do for a living? What is your job?
Well, I currently I'm a cybersecurity contractor.
Okay, cybersecurity contractor. What does that job entail? What do you have to do on a daily basis?
It doesn't require much. I sit down a lot at work. I have to sit down at my workstation for about 5 to 9 hours out of the day.
Okay. And how many days do you work?
About 5 times a week.
Okay, 5 times a week.
Yes, sir.
And is there anything else you do besides the cybersecurity?
No, not for work.
Okay. And besides work, do you have anything that you do for exercise?
Well, I mean, I play pool. I don't know if you consider it exercise or not, but you know, billiard's pretty serious.
Mm-hmm.
So
Okay.
I'll play.
It can be serious for
Yeah.
some people.
Yeah, so I'll do that. But also my grandkids, you know, running around after them, we'll fly planes together.
Okay, how old are your grandkids?
7 and 8.
Okay. Something, yeah. You go to the park with them a lot and stuff like that?
Yeah. We used to go to the park a lot and fly airplanes and stuff. They like doing that with me.
Okay. And since your injury, have you been able to go to work? Have you been able to play with your grandkids?
I still go to work. I just have to move a lot. You know, move a lot more. I'm trying to sit still. And then as far as playing with my grandkids and then pool, I really don't. I haven't been able to do that so much because the pain's just been so much that I haven't been able to do it.
Okay, so that is something that we can definitely get you back to doing with time if with the proper treatment and physical therapy. Okay, so your doctor referred you to physical therapy. Can you tell me a little bit about why you're here today?
I'm just having some pain, you know, in my neck, like my back neck area.
Okay, just around here.
Yeah, and then and then a little bit lower as well.
Can you show me where lower?
Yeah, about right here on both sides.
On both sides?
Yes, sir.
And on the neck pain, is it just on one side as well? Or
It's
is it
just
on
right in
both
the
sides?
middle. It's
Okay.
just right in the middle.
Okay, so can you describe that pain on the neck first? How would you describe that?
Yeah, it's just like a constant dull, achy pain.
Okay, it's dull and aching.
Yes, sir.
Okay, what about on a scale of 0 to 10, 0 being nothing at all, 10 being the worst pain you ever felt, how do you rate that neck pain right now?
I currently give it about a 2.
Okay, and when it's at its worst, what would you give it?
6.
6.
Yes,
Okay.
sir.
And then at its best?
About a 2.
Okay, 2.
Yes, sir.
And then for the pain, a little bit lower between your in your mid back. How would you describe that pain?
I mean, it goes away and comes back. It just feels sore.
Sore?
Yes, sir.
So you would say it's not always there, it just comes and goes?
Yeah.
Okay. And what is it right now on a scale of 0 to 10?
I'd give it about a 1.
Okay, 1. And then at its worst?
About a 4.
And then at its best?
I'd give it a 1 as well.
Okay. And do you have any numbness and tingling in either of those areas?
No, sir.
Okay. And before we move on, I just want to make sure. Do you have any pain that's going into a little bit higher in the back of your head in this area?
No, it just stops about right here.
Okay, what about the top of your head?
No, sir.
Anything in your face?
No.
Anything going into your shoulders? Arms?
No, sir.
Hands?
No, sir.
Anything in your chest or stomach?
No, sir.
Okay, so based on what you described to me, I have something similar to this, is that correct?
Yeah. Yes, sir.
Okay. Okay, so want to know a little bit more about this pain. Which comes on first? Is there something between those two?
I feel like this upper pain in my upper back neck area, that one comes on first, and then it'll cause more pain to the lower back.
Okay, so just to confirm, something happened here, and then it eventually starts hurting there.
Yeah, yes, sir.
Okay. And then a few more questions about that. When your pain does get to higher levels, around the 6 or the 4 out of 10, what are you doing to cause that?
What I'm doing to call that?
Mm-hmm.
Not much. I'm probably just sitting around watching TV, or I'm most likely at work.
Mm-hmm. And when you are sitting down, about how long does it take for this pain specifically to happen?
Probably about 2 hours.
Okay.
Yeah.
And is there anything else besides sitting down that causes that pain?
Looking up.
Looking up?
Yeah, like when I play pool, I have to look up. So.
Okay. And then what about for the little bit pain that's a little bit lower? How long? What are you doing when that starts to happen?
Same thing. Just
Same
probably
thing.
sitting down at work,
Sitting
or
down.
just sitting down.
And is that also about 2 hours, or does that take longer?
Well, I could probably takes about 4 hours.
Okay, 4 hours.
Yeah, sit down for 4 hours and they'll start coming on.
Okay. And when your pain does get a little bit to higher levels, what are some things that you do to help relieve that pain?
Just constantly stretching my neck.
Stretching.
Yeah, forward and backwards and up and down.
Okay. And then how long do you have to do that before the pain goes away?
Probably about 4 minutes.
Okay, 4 minutes. And then that is for the neck pain around here, correct?
Mm-hmm.
Okay, what about that? What do you do to make the pain between your shoulders go away?
I just lie down.
Just like to lie down?
Yeah, so that helps.
About how long do you have to lie down before that goes away?
10 minutes.
Okay. And between these two, what do you think is the best factor that makes your pain go away?
I'll probably say just at least moving my neck, since I can't lay down at work.
Okay.
I wish I could, but
Oh yeah?
yeah, sleep at work would be amazing. But
That would be
I can't
amazing.
do that.
Mhm.
So just moving my neck, it makes it help a lot.
Okay. And so in the morning, how would you describe your symptoms in the back?
It doesn't feel good. It feels worse in the morning.
Okay. Can you describe that to me more and worse? Worse how?
It just feels uncomfortable in the morning, like waking up. Once I move it around a little bit, it helps, but just waking up, it doesn't feel comfortable at all.
Okay. And what about through the day while you're at work or just doing daily activities? How would you describe that?
It really just hurts while I'm at work.
Mm-hmm.
All day. So that's when it starts hurting a lot.
Okay. And what about at night?
Just kind of feel like it's tired, like it just feels stiff and sore.
Okay, stiff and sore.
Yes, sir.
Okay, so after these questions, I have a general idea of what's happening. I just want to go back and then look at this form that you submitted before you came to me.
Okay.
So I noticed that you marked yes to feeling down, depressed, or hopeless. Can you tell me a little bit more about that?
Yeah. I mean, I just haven't been able to be myself, like play with my kids or anything. Sure, they're tired of playing with me, but it definitely affects me a lot. I just don't feel like myself since I've been able to play pool or play with them.
Mm-hmm. Have you been able to speak with your doctor about this?
Yeah, we talked about it.
Okay. And I also, you marked yes to use of alcohol, which is about 5 drinks per week. Is that spread out throughout the week, or is it more in like a single day, something like that?
It's spread out throughout the week. I wish I could have more, but
Mm-hmm.
got things to do.
Mm-hmm. Hang out with your grandkids, stuff like that.
Yeah, little regrets.
Mm-hmm. And then next, I also noticed that you have marked yes to high blood pressure. Can you tell me a little bit more about that?
I just have high blood pressure.
Okay.
Taking medication for it.
So your doctor does know about this.
Yeah.
And would you say it's managed well?
I think I do pretty well when it
Okay.
comes to managing it.
And I also saw that you marked yes for family history of cancer, high blood pressure, and heart disease. Can you tell me a little bit more about that?
But yeah, that's what they have.
Okay. And have you been seeing your doctor about this? Have you gone through screening, stuff like that?
Yeah, he knows it. I'm just trying to make sure that I don't get to the point to where I have those
Okay.
elements.
And then next, lastly on this form, you mark yes to trauma, such as a motor vehicle accident or fall. Can you tell me more about that?
Yeah. I fell from a tree, and I broke my collarbone because I was trying to hunt.
Fell from a tree?
Yes, sir.
About how long ago was that?
That was about 4 years ago.
4 years ago?
Yes, sir.
Yeah. Would you? Is that bothering you at all right now? Or
No, no, it doesn't bother me. It bothers me the deer got away, but
okay. Yeah.
besides that, no.
Things like that happen. So.
Yeah.
Okay. So next, I have a few questions for you. I'd like you to respond with a simple yes or no. So do you have any dizziness?
No.
Any double vision?
No,
Trouble swallowing?
No, sir.
Trouble speaking? Any nausea?
Nope.
And any numbness? Okay,
Sir.
thank you. And for this neck and mid back pain, have you gone to a doctor for any imaging?
No imaging.
Okay. And for your medication list, I saw that you put Lasix. Do you know the dosage on that, or?
No, I don't carry my medication around. I can let you know next time I come down.
Okay. But you would say you take it regularly?
Yeah.
Okay.
Yes, sir.
And then, so for physical therapy, I'm going to be teaching you some exercises. We're going to go through some goals. Do you have any barriers that you think would get in the way of your progress?
I mean, not necessarily. I think it's going to be hard for me to come here
Okay.
because I work a lot. So, I'm not sure if I'll be able to make it every session.
Mm-hmm. So we usually try to do around 2 per week, and if that doesn't
2?
work, yeah, sometimes you gotta work on it hard to get better faster.
Okay.
But if 2 times per week doesn't work, sometimes we could try to work around that, try to adjust the schedule.
Okay.
And also for how you learn, how would you like to be taught these goals or these exercises? Would you want me to talk with you about them, show you images, pictures?
I think just showing me like if I see pictures
Mm-hmm.
that help, and actually just doing it with me.
Okay,
That helps,
pictures.
yeah, I'm doing it.
Okay. Lastly, before we're almost done, can you tell me a little bit more about these 2 pains? When did they start? Were you in an accident or something?
Nothing really happened actually. Started pain. It just happened one day. Like my neck, this like neckish pain, upper back pain just really started hurting.
Mm-hmm.
Probably about 4 months ago.
4 months ago for this pain right here?
Yep.
Okay. And then what about the pain a little bit lower? Did that start also around 4 months ago?
No, I'd probably say it started like a month later. So about probably 3 months ago.
Okay.
It started to come on. Started to have issues with that.
Okay. And how would you say they've changed in the past 3 or 4 months?
I don't think getting any better.
Okay. So you would say it's probably worsening.
Yeah, I would definitely say it's worsening.
Okay. And what do you think is wrong with the area? Do you have any idea of what you think is causing you your pain?
No. I just know I know it hurts and it's sore and it's tight, so it just feels like it's constantly tight.
Okay. Constantly tight. And then, do you have any history of injury to that area? Has this happened before?
No. Okay.
Okay. So, last few questions. We're trying. These are some things that I can address in the clinic. What are some specific goals that you have from physical therapy?
I would say just getting back to work without pain.
Okay.
I don't like sitting at work for like 5 to 9 hours with terrible back pain. Maybe also play with my grandkids again and play pool. I miss doing that. So I probably said those are my goals.
Okay. So those are something that we can achieve from physical therapy.
Okay.
Okay. So do you have any questions before we move on to the physical exam?
No.
Okay, so after all that, can you give me a scale on 0 to 10 what your symptoms are like right now?
I give about a 2.
2?
Yes, sir.
Okay, and some of the following tests require me to place my hands on you. Is that fine? Okay, so first I want you to sit up nice and straight for me. We're just going to walk around, just make some observations.
Okay.
Okay. Can I have you stand up for me? Okay. Can I have you stand beside me really quick? Can I have you walk to the end of the table? Okay. Okay, next we're going to stand a little bit in front of this table right here.
Okay.
Next, I want you to raise your right arm above your head. Any pain with that?
No, sir.
Okay, I'm going to apply some pressure. Any pain with that?
Mm-mm.
Okay, now the next side. Okay, any pain with that?
Nope.
Same thing. Anything wrong with that?
No, it feels fine.
Okay. So next thing, I want you to have a seat again.
Okay.
So, can you show me a motion that causes your pain?
Yeah, just looking at it like that, how much it hurts.
Just looking up in general,
Yeah.
things like that?
Yeah.
And when you say it does hurt, can you give me a number on 0 to 10?
They give it about 3.
On the 3?
Yep.
Okay, is there anything else besides that, or is that the main?
That's the main one.
Okay. So next thing, I'm going to be measuring how your neck moves.
Okay.
So I want you to let me know if there's any pain with these motions or something like that, okay? So once you adjust the table really quick. Okay. I want you to bring your chin to your chest, try to make a double chin for me. Okay. Now I'm going to have you look up to the ceiling the best you can.
Mm.
Okay. A little bit painful. Can you give me a number on that?
Still about 3.
3 out of 10?
Mm-hmm.
And what about when you bent down? Is there anything with that?
No, it felt fine.
Okay. Next, I'm going to take some measurements standing behind you this time.
Okay.
I want you to let me know the same thing if there's any pain or discomfort with that, okay?
Sounds good.
So first thing I want you to do is to bring your left ear to your left shoulder. Any pain with that?
No.
Okay. Now your right ear to your right shoulder. How's that?
It feels fine. They just both feel stiff.
Okay. And so I'm going to be doing the same thing, but I'm going to be applying some pressure at the very end of that. Is that fine?
That's fine.
Okay, so I'm going to have you do the same thing. Try to make a double chin for me. Some pressure. Any pain with that?
No.
Okay. Now I'm going to have you look up.
Mm.
Same thing with there. Same pain you had from when you did it the first time.
Yeah. It just hurts a lot more.
Okay. And then last thing we're going to do, one more motion. Shouldn't be too much longer.
Okay.
It requires me to get behind you. So what I'm going to ask you to do is to turn to the left wall or turn to the right wall.
Okay.
Okay. Are you comfortable there?
Yep.
Okay. So first, I'm going to have you turn towards that left side for me. Okay. Anything with that?
Just feel stiff.
Just stiff?
Yeah.
Okay. Now I'm going to try the other side and have you turn to the right wall for me. Okay. What about that?
Stiff as well.
Okay, stiff as well. Would you say it's more stiff than painful?
Yeah. Definitely.
Next thing we're gonna do is I'm gonna be testing some of the sensations, some of your muscles, and some of your reflexes. This does require me to tap you with this little hammer and provide us a light touch, something like this. Is that fine?
Mm-hmm.
This also requires me to ask you to take your shirt off. Is that fine with you?
That's fine.
Okay, so I'll allow you to do that. Okay. So first, I want you to relax your arms and close your eyes for me. I'm going to be providing a slight touch like this, and want you to tell me if both sides feel the same. Okay. So does this feel the same as this?
Mm-hmm.
Does this feel the same as this?
Mm-hmm.
Does this feel the same as this?
Yes, sir.
Does this feel the same as this? Have you spread out your hands for me? Does this feel the same as this?
Yep.
This feel the same as this?
Yep.
This feel the same as this?
Yep.
This,
Mm-hmm.
this, and this.
Yep.
Okay. Next, I'm going to be testing some of your muscles. So first thing I want you to do is you can open your eyes now. So I'm going to have you bend forward, same thing. I'm going to apply some pressure. I want you to hold that position. Hold, hold, hold.
Okay.
Okay, next thing I want to do is I'm going to have you turn to your left side. I want you to hold that position. Hold, hold, hold. Now your right side. Hold, hold, hold. Okay, next I'm going to have you bring your left ear to your left shoulder. Okay, I'm going to try to separate. I want you to hold that though. Hold, hold, hold. Same thing on the right side. I want you to hold that. Hold, hold, hold. Okay, so the next motions, I want you to bring your shoulders up just like this. I want you to hold that position. Hold, hold, hold. Next, I want you to shoulders out like this. And try to push down. Hold, hold, hold. And next thing, put your arms in this position. I'm going to try to pull. Hold, hold, hold. Hold, hold, hold. Next, I'm going to do some. I'm going to push. Hold, hold, hold. Hold, hold, hold. Can you bring your wrists up like this somewhere? Straighten out your arms a little bit. Okay. You hold that. Hold, hold, hold. Hold, hold, hold. And now like this. Hold, hold, hold. Hold, hold, hold. Okay, can I have you bring your thumbs out? I want you to keep your thumb in that position. Hold, hold, hold. Hold, hold, hold. Now your fingers like this. Don't let me separate them. Hold, hold, hold. Hold, hold, hold. And then lastly, I want you to keep your fingers spread out like that and try to push them together. Okay, now like this, and try to separate them this time. Okay. Next, we're going to be moving on to reflexes. This requires me to slight tap with the hammer as I said before. So I just want you to relax your arms like this. Okay. This side. Now you put your left arm on your hip like that. I'm going to do the same on this side. Or I'm going to have you relax this arm for me. Okay. Move above your watch a little bit. Okay. And then I can have you put your right arm on your hip just as your left. Okay. And next, I'm going to have you hold out your hand just like this, both your hands. And if you relax this in for me. Same thing with this side. Okay. Everything seems fine there. Okay, next I'm going to be doing some tests, and I want you to let me know if you experience any pain, okay? So, first I'm going to be standing behind you. I'm going to ask you to turn a little, bend your head to the right side. I'm going to place my hand on top of your head and press down. Is that fine?
Mm-hmm.
Okay. Let me know if there's any pain. Okay. Anything with that?
Yeah, it really hurt. Right here.
You heard
The
it?
upper,
Like
yeah, the upper pain. Like, yeah.
Okay. Can you give me a number on that by chance?
Give it a 4.
4 out of 10. Okay. Next thing, I'm going to be having you lay down on your back on the table.
Okay. That's cool.
Oh yeah. Sorry about that. Okay, so can I have you, we're going to do the same thing and try to bring your chin to your chest. Try to make a double chin for me.
Okay.
Okay. Back down. Now I want you to do the same motion, but I want you to hold that for as long as possible, okay?
Alright.
Okay, can I have you do that? I'll have my hand will be below you. Okay. Here's as much as you can do.
Yeah.
Was it painful or was it just tired?
Just tired.
Okay. Okay, so last few tests. Can I have you lay on your stomach for me? Can I have you move a little bit further down on the table for me?
This way or?
Towards your feet. Okay, I'm going to raise the table. What I'm going to have you do is going to bring out your arm just like this. Just like that. I want you to hold that position. Hold, hold, hold. Okay, same thing. Bring out your arm. And can I have you bring it slightly up for me towards your head? I want you to hold that position. Hold, hold. Okay. I'm going to do the same thing on this side, okay? Can I have you bring out this arm? I want you to hold that. Hold, hold, hold. Okay. And then a little bit up. Hold, hold, hold. Okay.
Oh, man.
Is that hurting you or?
It's just weak, man. It's just weak.
Okay. Okay, next thing I'm gonna do is gonna be feeling some of the areas. And I just want you to let me know if there's any pain, okay?
Alright.
Okay. So just let me know. Can I have you put your arms at your side? Just like that. And I know that since you're facing downwards, I may not be able to see, but if you feel any pain or discomfort, just wiggle your fingers, okay?
Okay.
Okay, so
Right there.
right here.
Yeah.
Okay, what are you feeling?
It just feels a little painful and stiff.
Just stiff?
Yeah.
Okay. Anything here?
No.
Here's the table just a little bit. Right here?
Yeah. I had like the same spot you did before.
Mm-hmm. Okay, so right around here and right around here.
Yeah.
Okay, I'm gonna try to press it down just a little bit. Definitely really tight there. Do you have any pain with that?
Yeah.
Okay, so can you give me a number on that?
I give it about a 4.
Okay, 4 out of 10. Okay, so I can have you sit up for me now. So what I found during this test, I feel like there is some tightness in that area, and we have some muscles that go all the way from our lower back to all the way to our top. I feel that there's some tightness, but on the good news, we can stretch that area and strengthen it, and we should be able to get you to be able to play with your grandkids again. And then next, I'm going to be doing some treatments and giving you some possible exercises that you can do in or out of the clinic so to help you recover faster.
Okay.
Okay, so first, I'm going to be having you bring your arms out just like this. Any pain with that so far?
No, I'm fine.
Okay. I'm going to have you bring your arms out just like that. I want you to try to pinch my fingers together like that, much as you can. I want you to do that 10 times for me.
Okay.
I want you to just let me know if there's any pain, okay? Okay. And then how did that feel?
Feels a little better.
Okay. Adjust the table just a little bit. So next thing we're going to do, I'm going to be working on to help you get sitting up straight, things like that, okay? So first, I want you to sit at the edge of the table if you can. I want you to put your hands on your hips. I want you to move your hips around just like me until you feel your hips leaning kind of forward.
Okay.
Okay, and I want you to make sure your legs are facing down at an angle just like mine. So like if you were to spill something, you would just pour right down.
Okay.
Okay, and make sure your feet are already flat on the ground. That's already good. So next, I want you to bring your shoulders up, bring them, let them go back, and then relax them. Okay, and then I want you to keep your head nice and straight, bring it towards the ceiling. Imagine there's a string in the back pulling it upwards. Okay, how does that feel?
It feels okay.
Okay.
Takes a lot of work though.
Yeah. It does take a lot of work, but it's something that can be very helpful in the long run.
Okay.
Okay, so next thing I'm going to have you do is I'm going to have you lie on your stomach again. I'm going to do some treatment there, okay?
Okay.
Okay. Right around here, you said? Okay. We'll be doing some motions. Just wiggle your fingers if there's too much discomfort or too much pain, okay?
Alright.
Okay, I'm gonna start. This is gonna go for around 30 seconds. Okay, how do you feel right now?
It hurt, but it feels better.
Okay. Okay, everything fine was fine?
Mm-hmm.
Okay, can I have you sit up for me? Okay. So, do you remember that motion that I had you do earlier where you told me that it hurts when you look up?
Mm-hmm.
Can I have you do that for me again?
Yeah, about right there.
Okay. How does that feel compared to before?
It feels a little bit better.
Okay.
Yeah.
Better how? What do you say? Less pain, less stiff?
I feel like we can go farther.
And go further?
Yeah.
Okay, so we'll be doing things similar to this in physical therapy to try to get that area stretched out and try to get it strong again. So those first two exercises that involve doing this and the exercises that involve you sitting up straight, those are something that you can do at home. So the first one involving this, I want you to do that 3 sets of 10 repetitions.
Okay.
And I want to do that 1 to 2 times per day. And try to do that as many days of the week as possible. And then the second one, that involves sitting up straight, that I want you to do that maybe once every hour.
Every hour?
I mean, you don't have to, but it's something that could really help you in the long run.
Okay.
So
Okay.
if something such as, if you get a text message once every hour, so you can try doing that.
Okay.
And just repeat that, and then eventually you'll get stronger, and then you'll be able to sit up nice and straight, and you might not feel the pain anymore.
Okay.
And then the last one is something that I can do here, but that's pretty much it. Do you have any questions for me before I send you to the receptionist?
No, that's it.
Okay, it was nice working, Mr. Flinney. We'll go to our receptionist now.
Yes, sir.
Thank you.